Thank you for joining me for this discussion video. So this video is, as I stated, a discussion video about the script that I shared here previously, a consecutive interpreting practice script in English entitled Misgendered Mammogram. So this discussion will be applicable to interpreters of all languages. However, the translations and interpretations that I discuss occasionally will be in Spanish because I am a Spanish medical interpreter. So please be advised that the subject matter of this video and the previous video, these videos were not written by a medical professional, by a medical doctor. I am a medical interpreter, but I am not equipped to give medical advice. So please consult with your primary care physician or another healthcare provider if you have any questions regarding medical conditions and treatment. So the script begins with Dr. Smith greeting Noah. And here in the very beginning are where the problems begin. Noah's gender is listed incorrectly in the system, and Dr. Smith says Mrs. Lopez. Noah, however, informs Dr. Smith that they go by Noah, and Noah's pronouns are he, him. So, in this case, in Spanish, for my pronouns are he, him, you would say, mis pronombres son él, le. First the pronoun, then the object pronoun after it. And this reveals an issue that is well known in electronic health record management systems, or EHR systems. So an EHR system is what a clinic or hospital uses. I am familiar with eClinicalWorks. That is the EHR system that I have used in the past when I had a scheduling and administrative role in a clinic. And in eClinicalWorks, at least in the time that I used it, in order to specify anything aside from sex was the only option on the first page of the patient information. In order to add additional options, which you would have to add, you would have to go to the Structured Data tab and manually add in different fields. And then, of course, if you added in a field after you already had patients in the system, you'd have to go back and specify for many of these patients in the future. And very few EHR systems that I'm aware of offer more complex options that are accommodating of gender and gender identity as well as pronouns out of the box. So ideally, to be inclusive, EHR management systems should have assigned gender at birth for gender-specific services to indicate to a provider what gender-specific services that a patient might need, the patient's pronouns, so they are respected and validated when they are seen by their provider, and gender identity. And Noah, after this interaction, after Dr. Smith does what any polite provider would do, any respectful provider would do, asks if Noah would like to change their gender in the system. And Noah asks, is there an option for non-binary? So non-binary. In order to understand what non-binary means, you of course have to understand what binary means. And this is of course speaking about the gender binary. So the gender binary is a concept in some cultures that there are only two gender options, male or female. So duality, binary, two. Now, it's specifically worded this way because this is only present in some cultures. There are many cultures across the world that have more than two gender options. So, of course, non-binary would be anything outside of this binary. And many non-binary folks use the acronym NB to stand for binary, or even just say the word NB, E-N-B-Y. So in Spanish, to say non-binary, you'd say no binario. Very simple. It's the thing I love about Spanish is you have a lot of true cognates. And non-binary is really a spectrum of gender identities that may not specifically fall into male or female. Non-binary is outside of the binary. So I've actually invited a friend of mine to contribute to our little discussion here. So I have joining with me now my friend Dr. Carolyn Hutchinson, who, well, we'll go ahead and let Carolyn introduce himself.
My name is Carolyn Hutchinson, PhD. I hold a PhD in chemistry. I am non-binary. I have been featured by the American Chemical Society, specifically for being an LGBT scientist, and I have had to navigate health as a non-binary person before.
Okay. You actually helped me with this script, and there were two suggestions that you made to me. Do you remember what those are?
Is it terrible if I say no? I know one was.
The first one that you said originally, I had listed first that Noah introduced himself as non-binary, and then elsewhere they stated that they were trans, and that was the first thing that you had an issue with my script. So could you explain to me a little bit about why that was something that you felt I needed to change?
Yeah, so the way the script was originally written, Noah introduced himself as non-binary, and then said they use he, him pronouns, which is not the problem. But later on, the implication was kind of that basically it got a little muddied because later they were referred to as trans, but it came across in a way that was very binary, especially the way they were talking with their doctor and around the gender options. And so changing it from trans to just to non-binary made it more clear about what you're talking about.
So I wanted to change it to the double non-binary to make sure I was abundantly clear. And just like anyone else, I make mistakes too. No one's perfect. And I think that's important to realize as you're going through these things you're going to make mistakes. No one's going to be perfect. And that's why I have this wonderful person named Carolyn who helps me with things like this.
Yeah, and I make mistakes. We all make mistakes.
Very true. So the second thing, and I think this is what you remember, what you had asked me to add into the script. Do you remember what that was?
So that was what I asked you to add in was some sort of just a mention that sometimes changing gender markers can make getting certain treatments that are seen as gender specific very difficult. That's not always the case, but it's something that an individual should always check with their insurance and sometimes with an individual caregiver.
Yes, and obviously we're not going to be health insurance experts or any sort of medical professionals, but just with your experience navigating the healthcare system, being non-binary, these are definitely things that people need to look out for.
Yeah, and it really varies. There are plenty of cases where it's not a problem, but I know I haven't changed a lot of my gender options because either they're not available or it would make things like getting access to things that are seen as quote unquote female healthcare, they wouldn't be covered by insurance anymore and they would be prohibitively expensive.
So what would some of those services look like?
It would be things like mammograms, things like pap smears. I know a lot of people run into problems with pregnancy and obstetricians
Mm-hmm.
if it says male because a lot or other because in a lot of systems it just says, well, if it's male, if this person is male, they cannot need these procedures.
That makes sense. It makes sense that that would be an issue, rather. Well, thank you so much, Carolyn, for your contributions. And thank you so much for helping me edit this script. I hope a lot of people find it helpful.
Thank you. This was fun to work on.
So I really appreciate Carolyn sharing their time with us, sharing their expertise with us. Carolyn, occasionally, you may see, gives me some feedback on my articles on my website. Carolyn is just generally a very helpful person who has answered a lot of honestly really asinine questions that I've had and has had a lot of patience with me to provide answers to those questions. So I really do appreciate Carolyn's help with this. So, mammograms. Again, I am not a medical professional, That is, I am not someone in a medical profession who can give you medical advice. However, everything on this screen right now comes from the National Breast Cancer Foundation. And it is very well known that mammograms are a life-saving procedure. And in this case, this is one of those gender-specific services that NOAA has had issues accessing. And so people of all ages with breasts should do a breast self-exam every month. And this is something that NOAA was doing very well, which is what the doctor commended NOAA on. So why are breast self-exams important? Well, 40% of breast cancer diagnoses are actually as a result of feeling a lump on self-exam. So these are people who were doing their self-exams, discovered an abnormality, went to their provider, were given a diagnostic mammogram, that's typically how it goes, and it came back that they did have breast cancer. And the key with most types of breast cancer, again, according to my understanding, is that the earlier you detect it, the more treatment options you have available. That being said, if you do find a lump on self-exam, 8 out of 10 of those lumps end up being non-cancerous. I have interpreted for likely hundreds of diagnostic mammograms, and I've been quite fortunate in that I've only encountered a handful of cancer diagnoses from those hundreds. So just because you find a lump doesn't mean you need to worry yourself to death over it. You simply need to get it checked and take care of yourself. So routine yearly mammograms every year after 40 can detect tumors before they can be felt. So that's why these routine yearly exams are very important. So even though NOAA is doing his job and giving himself a self-breast exam, it's still important to get those routine yearly mammograms. Now, those recommendations for the age at which people should start getting mammograms really do vary by different countries. I'm just going by the recommendations here where I am located in Virginia. Top surgery. So at a later point in the script, NOAA simply says, I just want to get rid of these things, indicating their breasts. So top surgery is an umbrella term that is simply a surgery to modify the chest or breasts in some way. Now, in this instance, NOAA wants to remove breast tissue, which is made abundantly clear by the fact that they're indicating their breasts and saying they want to get rid of them. So some people have a different type of top surgery. There are different types. So some would actually like to have breast augmentation. Some would simply like to reduce the size of their breasts. But in the instance of this script, again, it's taking away breast tissue. And so this would technically be classified as a subcutaneous mastectomy, meaning it's a mastectomy in which you're taking the tissue out from under the skin versus a traditional mastectomy that we're used to hearing of, where in a lot of cases they remove a lot of additional tissue. So in this case, this would be translated or interpreted as la mastectomía in Spanish. You could say la mastectomía subcutánea if someone specifically says subcutaneous mastectomy. I've even seen el retiro quirúrgico de las mamas. I just don't know of a colloquial way of saying in Spanish at this time something in the same register as top surgery. And again, top surgery is a term, a very big umbrella term. So in an interpreting encounter, you may very well need to ask for clarification in order to properly interpret the term. So this really concludes the discussion of this script in terms of the script itself. But I just wanted to add to the end here that this script was inspired by a true story, actually inspired by many true stories, one in particular that I have in mind. So, the unfortunate fact is that many healthcare providers won't provide appropriate treatment and screenings to non cisgender patients, sometimes just to LGBTQ patients in general. Some providers will deny treatment completely. They will simply turn people away. And this is because, and this is specifically in the United States, I wouldn't be familiar with all the other countries in which this might be true, but at one time, gender identity was a federally protected class. However, in recent political changes, it is now not a federally protected class, meaning that it is a class that can still be discriminated against legally. This has resulted in, of course, many unfortunate cases where people do not receive the medical care they need, are simply disrespected by providers. And I attended a panel not too long ago in which a trans man mentioned that they had, it was either PCOS, polycystic ovarian syndrome, or uterine fibroids. I don't recall exactly what it was, but it was a very painful uterine condition, and they were simply being ignored. He was simply being ignored for quite a long time. And it got to the point where they actually had to seek emergency care to get their problem taken care of. And of course, at that point, the problem had gotten so much worse. So no preventative care was being taken. And this person really experienced a lot of pain and suffering as a result of being discriminated against for being transgender. So thank you so much for watching my video. Please stay tuned for more interpreting videos. I will be trying to post at least 2 scripts a week. I apologize if I don't stick to that, but I will do my very best. I also write articles related to interpretation and occasionally translation on my website, kghinterpretation.com. That stands for Kelly Gretsch Henriquez Interpretation.com. If you like this video, if you'd like to see more content like this, I encourage you to subscribe to my Patreon. So for as little as $3 a month, you can actually contribute towards my content, and I will be releasing exclusive content on my Patreon. And of course, if you can't commit to a monthly pledge, you can also go to my website, scroll down to the bottom of one of my articles, and I have other ways that you can contribute. And something personal now, I am currently experiencing a drastic decrease in workload as a result of the COVID-19 pandemic. My husband was laid off from his job, so I am the sole breadwinner in my family at this point in time. I'm trying to keep myself occupied by making these videos, but it would be great if I could have some folks contributing. I would greatly appreciate it, and I promise you it will be well worth your while. So thanks again for watching. Hope to see you again soon.